Yeah.
So we got Terry. We'll just go ahead and have people introduce themselves that are on the call right now, so we have to wait for everybody. And so go ahead, Terry, introduce yourself.
Terry Super, the president, Greater Kansas City chapter. What else? We've had a chapter for probably 14 or 15 years now, and we're working hard to get it back running, and getting it to be more and more exciting. Because over the years we've kind of let it lapse, but we're looking forward to big things happening in the next few years.
Good, good. I invited the presidents of the chapters, and some of them will be on, just so that they could hear what their chapter leader responsibility is supposed to be, and have a good feel for that, for working with them and making it happen. I know Eric, Ray, and I think Valerie both emailed that they would be on, so
okay, good.
So it'll be good. But if not, like I say, it's going to be recorded. So, all right, let's see, Tim.
Tim or Jim?
Is that Jim Smith?
No, it's Jim Shirk.
Oh, okay, close. Okay, Jim, go ahead. Tell us who you are.
Hi, Jim. I'm the Vice President, Cincinnati, Northern Kentucky chapter. I've been making some outreach calls to practices in our area probably since, well, seems like forever, but pre-COVID. I started making some calls in February. And anyway, with mixed results, but I've called a lot of people. So persistence counts.
Well, that's good, Jim. Yeah, making the calls is what's important, and it's always difficult to get a hold of the right person. So I understand the challenges you're faced with, especially during the COVID virus. So Mary, introduce yourself.
Hi, everyone. Yeah, my name is Mary. I'm at Lewis local chapter. I've served with the chapter for about 6 years now, personally affected with RP, and just in various roles, and currently serving as vice president of our local chapter. And I'm just passionate about educating our community about vision loss and helping to build our local community of those affected.
Great to have you on, Mary, in St. Louis. Okay, who else just joined?
Hey, Richard Pice here.
Who is it?
Oh, Fi's here from Arizona.
Oh, Fi. Okay, good. Fi. Well, everybody probably knows Fi, but introduce yourself, Fi.
Sure. Hi, everybody. My name is Fi Mo, and I am the chapter president of Arizona. And I also have RP. So this is, well, I call you guys my peeps, for those of us impacted, and definitely grateful to be part of FFB and serving alongside of all of you. So.
Great. Good to have you on. I think Patty said she would be on. Patty, are you on yet?
Yes, I am. I'm here.
Oh, okay, Patty, go ahead and introduce yourself.
Great. Thanks. Patty Wilburton, and VP of the Phoenix chapter, Arizona chapter, I guess we should say. And I am the professional outreach. That's also part of what I do for FFB.
Beautiful. Good to have you on tonight, Patty.
Thank you.
Who else have I not met yet? Anybody else? Okay. All right. Well, then, Ben, you want to say hello?
Sure. Hello, everyone. Ben Shaberman from the headquarters, which is my home, is my headquarters now. But I work with Michelle on the professional development team, among other things, as I think many of you know. And thanks for joining us.
All right, great. Elaine, you want to introduce yourself?
I'd love to. My name is Elaine Rosatko. I'm out of the suburbs of Chicago, Illinois. I am the chapter development assistant, and I am here because I have the Zoom login.
All right, she's our Zoom expert. All right, we need that. Anybody else join before we move on to the program? No? All right, well, I'm sure some others will probably pop in as we go, but Michelle Glaze, take it away.
All right. Well, thank you all for joining us tonight. I hear a lot of familiar voices. So I've talked with many of you, but for those of you who don't know me, I'm Michelle Glaze, Associate Director of Professional Outreach, and I work with Ben on our team of 3. We have an assistant named Katie that I don't think joined us tonight, but we're excited to talk to you about professional outreach. Just a little background on me for those of you who don't know me. I was diagnosed with RP clinically in 2004 and did not have many symptoms at the time. So I spent about 10 years just kind of denying that anything was going on, and really did my best to hide the fact that I had vision loss until I started to really feel the challenges of my RP. And that started with problems driving, and I quit driving in 2011. And so at that time started to look for some ways to find out more, and I found the Foundation Fighting Blindness. So I participated in my first vision walk at that time and stayed connected with the organization. Really got reconnected strongly in 2018 when I decided to do a local event to try to raise some money to help drive research. And at that time I got connected with Jason Minzo. My professional background is I've got over 15 years in business development and sales experience. I was a pharmaceutical rep for a long time and also was in the lab industry. So worked with a variety of physicians and different professionals through my role in those fields. And when I started talking with Jason, he had this vision for professional outreach, and it really was the perfect marriage for me of personal passion and professional experience. So I was very glad to join Ben in 2019 to roll out professional outreach. And today what we're going to do is just share a little bit about what it means to be involved with professional outreach, kind of some of the expectations and what all it entails. And going to spend a lot of time talking about chapter volunteers and how to get involved and what you will be doing if you decide to participate. And as I mentioned, some of you are already doing this. So hopefully it's some information that will be a refresher, or information that for Patty and Jim who are already participating, perhaps you can share this information with other volunteers who might be interested in helping. So before I launch into the presentation, Ben, did you want to add anything to it, or you want me to just go on in through it?
Again, welcome everybody. Thanks for learning about professional outreach, and Michelle, take it away.
Okay. All right, so just an overview of what we do, what professional outreach is. Our overall mission is really to connect with eye care professionals across the nation to raise awareness about the Foundation's resources for individuals with an inherited retinal disease. We have three primary goals in my mind in serving our mission through the professional outreach team. One is to develop collaborative relationships with all professionals who serve the audience that we serve, which is folks that have blinding retinal disease. We want to inspire professionals to refer these individuals or their loved ones to the Foundation, learn about the resources that we can provide. And then last but certainly not least, we want to educate eye care professionals about not only resources available to their patients, but also available to them through our program. And I think one key aspect to this is the MyRetina Tracker genetic testing program that we offer. And I will spend some time kind of going through that later on in the presentation, because whether or not you decide to participate in professional outreach, I think it's really important as a patient and as a volunteer for the Foundation to be aware of this program so that you can share information with others who might benefit. So this is a different approach really than you probably are familiar with as far as the foundation is concerned. This is not a fundraising type of opportunity through professional outreach. We don't do any direct fundraising, although fundraising can be an end result, certainly. Our goal is really to build and cultivate long-lasting partnerships with the providers and professionals with whom we connect. And we really want to strengthen our ability through these professional networks to connect earlier on in the vision loss journey with individuals who have an inherited retinal disease. So our goal is, as we're going through and forming these relationships, that we're encouraging professionals to, to connect their patients with us. And what we have found is through professional outreach, we really have made some impact in the way of bringing in fundraising opportunities. So though it's not a direct ask, often the end result is that these clinics, organizations, individuals will come to us and say, yeah, we want to participate in events, or we want to sponsor a Vision Walk team. And Patty has some really good examples of that. And Patty, I may have you share some of those later on in the presentation. She's done a really great job in the Phoenix market. There are several different channels that we utilize through professional outreach to share everything that the foundation has to offer and to reach our audience of different groups and individuals who can help share our message. Ben and I spend a lot of time working with the groups that we call centers of influence. And these are points of contact where one individual can really share information about the foundation with a larger audience. As we are a small team trying to reach professionals across the nation, it's really important to try to capitalize on opportunities to have others help us to share this information. So some of these centers of influence are key opinion leaders. These are experts in the field of optometry and ophthalmology who perhaps present at conferences, or they're just influential in the industry overall. Professional organizations, there are state-based organizations, regional organizations, national organizations that we do try to connect with to share information. Schools and colleges of optometry. There are a multitude of these all over the place. And the great thing about schools and colleges of optometry is it gives us an opportunity to connect with students, residents, faculty, and educate, especially the students, about who we are and what they can offer to their patients even before they get out into clinical practice. So we're catching them early on, and we've had a lot of success with this center of influence in this group. Large eye care facilities and clinics, usually there are a multitude of physicians, so through one point of contact, we may be able to reach 100 plus eye care professionals. So that's a good group to target. And then the low vision community leaders. And we have really found through professional outreach that this community has been very open to partnering and collaborating, and we've formed some really good relationships with this particular entity, and we really look to expand that as well. Back before COVID, Ben and I spent quite a bit of time, he even more so than me, doing conferences and participating in different conferences. And conference participation allows us to connect with some of the centers of influence that I mentioned above, share information, obviously, with professionals that are attending those events. And then also we have the opportunity to present in some of those forums. So it allows us to share, again, to a larger audience. But last but not least is our chapter-led group of our chapter-led channel, which is the group of volunteers like yourself who have identified that they want to help with professional outreach. And this is a really important way for us to reach individual practices in specific communities and markets. For me to reach out to every single practice across the nation is just, it's not feasible. But if I can solicit some help from volunteers that are willing to do that and want to do that, it's a great way to get people connected in different markets and communities across the nation. So I've done a lot of work to really foster this channel, and that's where we'll spend the bulk of the presentation today. So you, as a volunteer, are probably the best advocate out there for the foundation and for professional outreach. As a person with an inherited retinal disease or the loved one of a person who has an IRD, you are most definitely the ideal spokesperson for professional outreach. The opportunity for you to share your story and your connection to the foundation is really powerful. And it's a great way to form a bond and a connection with professionals in your local markets. All right, so let's dive into chapter-led outreach. What does it look like? What are you gonna do? What is to expect if you decide that you want to participate? First and foremost, it's not something where you're just gonna be thrown to the wolves, if you will. I do spend a lot of time, especially in the beginning, walking and guiding and helping you to figure out what you need to know to get started. So typically when I have somebody that comes to me as a volunteer who wants to participate, we have an initial call, and that's usually one-on-one. And this is an opportunity for me to talk a little bit about what you'll be doing as a chapter leader with professional outreach. I have an opportunity to learn about you and your experience and connection with the foundation. And that allows me also to answer any questions that you might have. After that initial call, if you are deciding that you for sure want to move forward with it, I'll provide a list of targets so that you know who you're reaching out to and who to contact. It's not something where you have to go out and find these folks. I do help with that. I'll provide an overview of the information that you need to gather and things that you need to be prepared to discuss whenever you start with your outreach calls and contacts. And we'll also practice sharing your personal story and asking questions. And that's something that, of course, you will need to do on your own time as well. But I certainly go through that and share my story and go through the different ways that I make calls and things I say. So that's something that we do. And then we also have monthly check-ins. And in the beginning of outreach, sometimes it's a little bit more frequent, but typically it's once a month. We'll hop on a call. We'll go through any updates that you have, challenges that you may be facing. I can help answer questions. And also we can discuss like the appropriate time to pass the lead along to me, or to bring me in and get me involved, or to host a webinar with Ben and I, or whatever the case may be. So it's an extensive process there in the beginning, just so that you have everything you need to get out there and feel comfortable when you are reaching out to professionals in your communities. I think a lot of people initially think that retina specialists are the only groups that we're targeting. And that's certainly not the case. The best group of individuals for you to reach out to initially are your personal network of providers and professionals. So as a person with an inherited retinal disease, or the family member of someone who has an IRD, you certainly have your own doctors. You may have a vocational rehab counselor. You may have a low vision specialist you go to. If your child has an inherited retinal disease, perhaps they have a school that they attend. So these folks that you know and that you're comfortable with are the perfect first group to to connect with, to share information. They're considered your warm leads. And that is a good jumping point for you to get some experience in figuring out what you want to say and how you want to say it. Of course, optometrists and ophthalmologists locally are going to be targets. And yes, retina specialists are a group of individuals that you certainly are going to be calling on. There are also pediatric ophthalmologists that are good targets. As I mentioned, low vision specialists. And then there are some other professionals and other groups, rehabilitation services, vocational rehab, which are usually state-based, occupational therapists, perhaps school for the blind, the teachers and counselors there. So there are a lot of different groups that you can add to that list of targets as you're reaching out and connecting in the community. And if you have a local organization that you're involved in, that's a really good group too to connect with and share information with. So when you start to reach out and do calls, this is primarily done over the phone and via email as well. There may be some opportunities, especially pre-COVID, where you'll get out and do some site visits. And I do have some volunteers that do prefer face-to-face visits and like to get out there, and that's great. But it certainly isn't something that's required. Most of what I do day to day is through phone and email, and that's primarily what you'll be doing as you're really reaching out and getting busy and getting your connections going. Information that you're going to gather when you start making phone calls. Is this an appropriate target? Does this group see patients with inherited retinal disease? If they don't, do they refer out? Who do they refer to? So that will be some information that you'll want to know and gather. Who's the best point of contact? Is it the practice manager? Is it a patient liaison? Perhaps a clinical coordinator? The vocational rehab counselor for the blind? Who is it that I need to be speaking to when I'm making these calls and trying to connect with the providers in this practice? And what kind of information can I gather when I'm making these calls? These are things like, what's their email address? What's their extension? Is there a time of day that's best to reach out? Do they have a day where they don't have clinic, where they're more accessible? Do I need to schedule an appointment to speak with this person? And that's all information that you'll gather through a series of phone calls or a series of contacts. Do they know about the foundation? Is there a history there? Probably most of you would know if there's a history because you've been involved for a while. But if it's a new group, perhaps you don't. And it's okay to ask. Do you know who the Foundation Fighting Blindness is? Do you know what we do as an organization? And that way you know how much information you need to share and how much history you need to provide. And then certainly you want to be thinking ahead. What's my next step? What's the goal for this call? What's the goal for my next call? As you're doing outreach, it's often not going to be the first call that you make that you're going to get to the person you need to talk to. Sometimes you get right through, but I would say more so, it's going to take several calls. So be patient with yourself and understand that we all go through the process of trying to figure out who and when and where and how do I build this. But as you're gaining information and gathering information, you're going to want to make sure that you take good notes so that the next time you call, you can use the information you've gathered in order to move yourself forward in the process of connecting. When you finally get somebody on the phone that you want to connect with and talk to, of course, you want to know what you're going to say. And oftentimes, these people don't have a lot of time. So I always encourage volunteers, and I do myself as well, to share your personal story. And I don't mean an hour-long dissertation about your story. It has to be succinct, maybe a 30-second snapshot of how you got connected with the foundation, why this is important to you, and to, oh, by the way, I have retinitis pigmentosa or whatever it is. This is a way to emotionally connect with whoever's on the other end of the line. And, you know, people, when they know that when there's an emotional connection, they're often more willing to talk and help. And so if they know why you're calling, they're probably going to be more willing to give you the information that you're asking for. Of course, you're going to want to be able to share our mission statement. You know, the organization drives research to find treatments and cures for inherited retinal disease. And you're going to want to be able to share the foundation resources. So local chapters, events that are upcoming, research updates, and of course, the MyRetina Tracker genetic testing program. So let's talk for a minute about the MyRetina Tracker genetic testing program. I hope that all of you on the call know that we had a major change to this program last year, and now it is open to all eye care professionals in the United States. This is a partnership between the Foundation Fighting Blindness, obviously, Blueprint Genetics, and Informed DNA. In my opinion, the MyRetina Tracker genetic testing program is the most holistic program out there. You know, it's not just a way to get a genetic test. Our program offers genetic testing. We help patients understand their clinical and genetic diagnosis. We help them to figure out what the next steps are. You know, we encourage and require genetic counseling so that they understand where they are and where they're going. And then, of course, through the MyRetina Tracker registry, there's a sense of hope that perhaps they're going to be contacted for a clinical trial. There's a lot of information that our program provides. The support of the Foundation Fighting Blindness is there, and it's not just genetic testing as the only entity. The program is free, and it's free genetic testing and free genetic counseling. All patients in the United States who have been clinically diagnosed with an inherited retinal disease are eligible, provided that they have not had genetic testing with a panel of more than 32 genes over the last 4 years. As I mentioned, it's open to all eye care professionals who can clinically diagnose an inherited retinal disease. There are some restrictions in some states for optometrists, but for the most part, all eye care professionals will be able to access this program. And our partners are great. I mean, Blueprint Genetics, the panel it's very broad, very deep. There are over 322 genes that are tested. And Informed DNA is an amazing genetic counseling partner for us. Their counselors are very knowledgeable in inherited retinal disease. They are very patient focused. Everything is done from a patient's home, so the counseling is over the phone. You don't have to worry about trying to get to a facility. You just receive a call, and they do a really good job of not only explaining your genetic test results, but also helping you understand your family history and clinical trials that are ongoing. You know, they help to paint a really good picture of what might be next for you as a patient. And certainly, it's important to note that the MyRetina Tracker program, all aspects protect patient privacy. So patients do not have to worry about their information being shared with any third parties or anything like that. And that's an important aspect of the program. So what can we provide to eye care professionals? There's collateral, and I know that I've had people say, oh, is this all we're doing is taking materials into offices? And no, this program's much more complex than just that. But we certainly do have a variety of brochures that we do want to share with our professional outreach partners. We have some Beacon of Hope brochures, MyRetina Tracker brochures. We have some newly diagnosed pamphlets. some easels that are really nice to set up by a receptionist area with a little tear sheet so that people can grab some information quickly about the foundation. We have disease literature and things like that that we can provide as well. But I think even more important than that is Ben and I have spent a lot of time to make sure that we're communicating through the use of webinars and teleconferences to really drive home all of the great resources that are available to patients, the genetic testing program that we have to offer, clinical research that is underway, emerging therapies that are underway, and also continuing medical education courses. We launched our first continuing education course in May, and that's available on our professional outreach webpage, which is now accessible from the homepage for the Foundation Fighting Blindness. And we're also getting ready to launch our second continuing education course in October, which is just right around the corner. So hopefully some of you received the information about that, but I certainly can get it out to you. And those are some of the types of things that I communicate with our chapter leaders who are participating in professional outreach. So, so that information is available to share. We also offer patient support. We have a phone number and an email that patients can utilize if they want more information, and of course our website. So these are all things that eye care professionals can offer to their patients, which, I don't know about any of you, but I'm sure that there are many stories where when you went and got, had your first visit with your retina specialist and were diagnosed, the answer is often, you have this disease, there is nothing we can do. I'm sorry, come back and see me in a couple of years. Well, with all of the information that we're sharing with professionals, now they have something to help their patients, to tell their patients. They can give out a brochure, they can share the fact that the foundation offers genetic testing. Oh, by the way, there are local chapters. So there are items that we provide that they can then turn around, and we hope that they do turn around and share with their patients when they are diagnosed with inherited retinal disease. I hope that many of you who aren't currently participating in outreach are considering this. And I think that it's really important that before you get involved, you really think through what you're going to be doing. I do spend a lot of time with our volunteers, and our volunteers dedicate a lot of time to helping with professional outreach. So I think that it is important and fair to think through through the process before you agree to jump in with both feet and assist. So some things to think about before you decide to participate are: how much time do you have to commit to outreach? How much time daily, weekly, monthly? There's no right or wrong answer here, but certainly, you want to make sure that you're going to have some free time to dive into professional outreach, because it does take time to make phone calls and to send emails and to, connect with me and, learn what you're going to do and how to do it. So that's something that you're going to want to consider and think through. Are you willing to do cold calling? It's different, and you need to make sure that you're comfortable with picking up the phone and reaching out to somebody that you don't know and asking some questions. And I certainly will help with that, but it's something that is a part of this, the professional outreach efforts. Do you feel comfortable with sharing your personal story? And I've struggled with this myself. It's something that you've got to push yourself, and some people have no problem with it. But your personal story is going to be important in connecting with these groups. And last but not least, will I be diligent in sharing information with both me and your event, the events directors, the chapter leaders? As you're making calls and making these connections, it's important that we're able to capture all of that information that you gather so that we can continue to expand that relationship and to continue to build on it. So, you know, that communication is really important. So as I mentioned, our team is 3 strong. It's me and Ben and our administrative assistant, Katie. We're here to help, and certainly you can reach out to us if you need anything or want more information. And unless there are questions, I don't know, Ben, if you have anything you want to add to.
Just a quick comment. Nice job, Michelle. When we first started doing outreach, and Michelle was the one really working on the front lines, but when we'd make contact, I was a little intimidated about reaching out to eye doctors because they're doctors. But it's really remarkable how many eye doctors really don't know our space at all. And so I think going in, you can feel confident that being a representative of the foundation, and whether you know a lot or even a little bit, it's probably more than most private practice eye doctors and optometrists know. And not every physician is going to be interested in helping IRD patients, but there are many who want to. And for those who want to, I think you'll be welcomed with open arms, if that doesn't sound too much like an exaggeration, Michelle. The doctors that really want to help are going to. And they may not understand genetic testing and some of the other aspects of our resources and programs, but once you make that connection, we can help with that. And you'll just find the people that really want to help, and they'll be excited to do it because they really care about their patients.
And, you know, I would like to share too, Jim's done a lot to start to connect with folks in his area. Patty has been doing professional outreach now for, gosh, I think a year. And one thing that, just to share a story on how this can kind of progress, and Patty, please feel free to hop in. I'm gonna pat you on the back because you've done a great job. So Patty got started with outreach. She made some very key contacts in the Phoenix market. And she and Phi got word that Ben and I were going to be in Scottsdale for a conference. This was last December. And what they did was they worked to form a little dinner meeting for us. So it was a really good opportunity for us to strengthen the relationships that Patty and Phi had built, and we were able to come in and share a lot of information about research and genetic testing. It was a great connection with those three main groups that Patty had been working with, and I believe that it also even led to some sponsorships for Vision Walk and some fundraising efforts. So, you know, I love stories like that because, as I mentioned, you know, we're not directly asking these groups for fundraising. However, through the connections and the resources that we provide and the relationship building, that's one example of how it circles back around to where they come to us and want to help. I don't know, Patty, if you want to share it all about that particular. And I don't want to put you on the spot, but I thought it was a really great professional outreach story. And Ben and I were very excited to connect with those groups while we were in Scottsdale. So,
well, first of all, thank you so much for that wonderful intro. It was such a great night that you were talking about, and I set up a little bit of a strategy here in Arizona. I thought, I know what I'm going to do. I'm going to go after the big guys first, and then I'm going to get the little swimmer, the little fish afterwards. And still working on a lot more possibilities. But through the practices, we got some key people in American Vision Partners, which is one of probably our largest practices here in the area. I think they have about 60 they've bought out. They're in the umbrella of about 60 practices, I think. And then a couple of our other practices here too are large. So that evening was great, and Phi worked well too with sending out invitations. And then when you guys came, it was really good. And I do believe that at our Vision Walk, as we've been told, Arizona was the only one who was allowed to have the Vision Walk this year. We had I think it was the CEO of American Vision Partners, this huge corporation, give just a few words at the walk, and they had the second largest team there. So inadvertently, yes, Michelle, it did lead to that, but it was gaining that relationship with the, what I would say the pivot person, or the one who you were referring to earlier is going to be your point of contact. So it's been good. I've enjoyed it. I'm familiar with the medical field myself, as I work in the medical field. So it is, it's something that is close to my heart, and I love seeing some of the results from it too.
Thank you for sharing, Patty.
Yes.
Any questions from anyone out there for Michelle? Well, I have a question that, since I don't hear any others. Michelle, I heard you mention you had brochures and stands and stuff like that to supply. My question is, how do you ship that? What's the logistics of handling, how many you ship and et cetera, et cetera?
Yeah, good question. So what I traditionally do is when volunteers at the chapter level get started with professional outreach, I have some limited items sent to them directly, just so that they have in their possession an example at least of what we have to offer, and some extras for if they go in, to an office and want something to leave behind. So they usually do have some resources. But when a clinic expresses interest in having materials for their clinic specifically, what I have our volunteers do is send me an email with the point of contact, the name of the practice, and the address to which they want the materials shipped. And then Katie sends those items directly to the clinic. And that's what, that way volunteers don't have to worry about trying to send stuff out, and we can just get that taken care of on our end.
Oh, I think that's great. If you don't mind, could you send me a list of what you have to offer as far as materials that are shippable to a doctor's office? And
Sure.
I'd like to take a look at that, because I know I have several relationships here in Colorado that definitely, we used to do that years ago when that was possible. And so now that I hear it's back, I didn't even know it was back. That's great service. And I know they would probably be interested in getting some of these materials, because they do support the foundation in a big way.
Yeah, absolutely. Be happy to.
Okay, I think we had one new person come on the phone. I think I heard a phone number come in. Is that person, can you introduce yourself? I'm not sure who it was, if they're still here. Okay. All right. Well, Kelly, are you still here?
I'm here.
We didn't introduce ourselves. Kelly, go ahead and introduce yourself. What your role is with the chapters.
Sure. I am the manager of chapter engagement. I previously worked in events, so I'm rather new to this role. So this is really helpful. Thank you, Michelle, for the overview of this. I'm working with 7 chapters in the Midwest area. With, I believe, the only one that's on the phone currently that I'm working with is Cincinnati, Northern Kentucky.
Great. And my name is Richard Fabian. I didn't introduce myself at the beginning. I know many of you, but I'm Senior Director of Development, and I handle 4 chapters: Arizona, Colorado, Kansas City, and St. Louis. And I also manage mid-level donor programs. So I work with major donors and supporting them and fundraising and all that good stuff. And I do the Colorado Vision Walk. So it was really great for all of you to come out tonight and to participate in this webinar to learn a little bit more about professional outreach. Thank you, Michelle. Thank you, Ben, for your presentation. And we have this recorded so we can share that with others who weren't able to make it tonight. Thanks for being here tonight. If anybody have any other further questions? Okay, thank you. Let's go watch the
Thanks, Richard.
Chiefs and the Ravens.
Thanks, Richard.
Go Chiefs.
Bye-bye.
Bye-bye.
Thanks, you
Bye,
guys.
everyone.
Bye.
Bye, folks.